Is we're going to do a Dermaroller treatment on Gina now. What we've done is we've put an anesthetic cream on her skin to make her skin a little bit numb, so that when we're working on her skin she won't be able to feel the actual process of rolling. Now what we're going to use is the Dermaroller. We're using the medical roller on Gina, and that's applied by Lamal. We actually use the German Dermaroller, so it is the only patented one. So you can see it comes in a sealed packet. It's sterile when we open it the first time, and it's nicely packaged in this little package. If you look at the needles, that's the length of needle that we're looking at. Alright. So what we're going to do now is we're going to remove an area of the plastic or the cellophane. We're going to wipe off the anesthetic, and then we're going to start to roll. Okay. We're going to take the cream off, and then what we do is we do a specific movement. I'm not pressing very hard, and we actually make tiny little holes into the second layer of the skin called the dermis. What our aim is to create as many little punches in the skin, and what that will do is it will create an inflammatory process which will break down all the collagen and elastin that's causing the aging look of the skin, and your skin will then rebuild it with a natural new collagen and elastin. Now what's very important is that we are creating a little bit of redness, but that we aren't actually creating any bruising or any deep injury to the tissue. She can feel it a little bit. Now we've made the skin nice and porous, so what we're going to do now is to actually apply a little bit of serum to the area. So we're feeding the skin very well. We're giving it everything that it needs to regenerate and to take away those lines and wrinkles. What Gina will see with her treatment is that with her first treatment there will be a little bit of change, but you need subsequent treatments to really give you a total change of the skin. What we're working on are signs and symptoms of photoaging. Those would be things like lines, wrinkles, fine lines. Of course, the texture will change on her skin, and she'll also see an improvement in sagging. Not that Gina's got very sagged skin. Right, and what we do is we just continue the process right across the area that we have anesthetized. Very important to work only in the area that you have anesthetized, because it is a little bit uncomfortable if you do go over an area. Okay, so we're basically working in 4 directions, and we're doing 4 passes in every direction. We've completely rolled all the areas on Gina's skin, and you can see she's slightly red. Here and there, there's a little bit of a blood spot, but nothing too serious. What we're going to do now, we've put serum on, but we're going to calm the skin down with a mask. We specifically use a mask that contains growth factors, so that we are feeding the skin well once again. This will also give the skin a nice hydration effect, because there is a little bit of hyaluronic acid, which is a starch in the product that will give you a little bit of plumping and water retention. And so by the time Gina leaves, her skin will be completely calmed down, and basically she'll look like she's had a she's been in the sun a little bit too long. We apply that, and that should feel nice and cool. We've also worked on Gina's neck, just because that is an area where people do tend to forget that they age, and it is also an area that is very sun damaged and exposed to a lot of sunlight. What I'm doing is I'm just taking a little bit of the excess gel and just applying that to that area. Great. And that's it. Thank you.